So I'm here today to talk about viral gastroenteritis. So viral gastroenteritis is very common, especially in low resource countries. Um, it can be caused by coming in contact with an infected person or eating/drinking contaminated food and water. So some things you need to know are the signs and symptoms of the disease. Signs and symptoms include watery diarrhea, nausea, vomiting, stomach cramps, headache, muscle aches, and possibly a low-grade fever. These symptoms typically start within 1 to 3 days after exposure and last around 1 to 2 days and no longer than 14 days. This disease can be life-threatening in children, older adults, and immune-compromised people. For treatment, there is no effective treatment because it is a viral disease. So treatment is most of the time based on your symptoms. Rehydration is the key to this disease though because of how many fluids you're losing. So some rehydration techniques can include drinking lots of water, eating fruits and vegetables, and oral rehydration solutions that are made up of water, sugar, and salt. These are common things that people can find in their house or have access to in the clinics. It is important to go to your local clinic if you cannot keep food and water down for 24 hours, you are vomiting blood, you've been vomiting and having diarrhea for more than 2 days, or if you are dehydrated or have a fever of 104 or more. If your baby possibly or your child has gastroenteritis and you want to know when to take them to the clinic, you should take them when your baby seems very irritable, they have a fever of 102 or more, they have bloody diarrhea or seem dehydrated, so they'll be very, not their normal self, dry mouth and stuff. So prevention is best when it comes to gastroenteritis because it is a viral disease, so there's not a treatment like an antibiotic. Prevention includes washing your hands frequently, drinking clean water, exclusively breastfeeding for the first 6 months, having good personal hygiene, and making sure all foods are cooked thoroughly. So the handout that I would be giving out is this handout, and it says all about gastroenteritis. It has a picture of how to prevent gastroenteritis and just has some of the basic information that we went over, how long the symptoms should last, what the symptoms are, the rehydration techniques, prevention keys, and then also giving out a handout of how to properly wash your hands, how to wet your hands first, then apply soap, and then scrub your hands together for 15 to 20 seconds, then rinse with water, and then dry off your hands. So this is what information that I would be giving in low resource countries on a mission trip about viral gastroenteritis.